Welcome back to Face the Nation, and we're going back to the Ebola story. The World Health Organization reported Friday that Ebola has now killed at least 4,555 people, but experts say that number is likely to go much higher. CBS News reporter Debora Patta spent 6 days in Monrovia, Liberia last week. She filed this report about her experience there.
You really get a sense in Liberia that for a country only recently emerging from civil war, this Ebola virus has just been devastating. The minute you land in the capital, Monrovia, you're on your guard. Washing your hands with chlorine before you enter public places is mandatory, as are the regular temperature checks. The already dysfunctional health system is broken under the strain, and as hundreds of infections turned to thousands, there were simply not enough beds to house the sick. A quick walk around the capital made it abundantly clear there is virtually no infrastructure to speak of in Liberia. That's where the United States and other nations started shouldering some of the burden, as we saw when we visited General Darrell Williams at his beachfront headquarters.
The U.S. military is not here to solve Ebola. The CDC, AID, the leaderships provided, the government of Liberia, the U.S. Embassy here, all the folks that I mentioned, that team of teams is what's going to help stop Ebola or contribute to stopping Ebola.
But the passionately dedicated Doctors Without Borders rightly points out that building new treatment centers is not enough. Who, they ask, will staff them? Care for Ebola patients takes long hours of training, and they've been persistently sounding the alarm for the last 8 months now, but this has largely been ignored. Perhaps the latest dire predictions from the World Health Organization of 10,000 new infections every week by the end of the year, unless more is done, will be the final tipping point. Of course, like any story of misery and suffering, there are always incredible heroes. I have a profound new respect for health workers working in brutal conditions in those stifling, claustrophobic protective suits. Like the world-renowned virologist, Dr. Dan Lucy, we caught up with him on a good day. A family of 3 he thought wouldn't make it had walked out of the treatment center Ebola-free.
Now today it's one of the best days of my life because they're survived.
It takes quite an emotional toll, doesn't it?
But it's worth it. So I'm happy to be here.
And of course, there are the ordinary Liberians doing extraordinary things to help their country. Some of them have the most dangerous jobs in the world, yet they show up day in and day out. Like this ambulance team who were called out on yet another run into the West Point slum to fetch a man showing symptoms of Ebola. As they race through the warren of narrow alleys, you are reminded of just how contagious this virus is and how one wrong move could be fatal. The man was placed in an ambulance heading off for a treatment unit. He continues to struggle for his life. Those who are lucky enough to survive are often shunned by their community. There is still a lot of stigma attached to Ebola. Health workers risk their lives every day. We met Diana Sarte, an Ebola nurse at Monrovia's JFK hospital. Every morning she prays with her children before heading off to treat her patients.
Even though it's dangerous, but I took oath to save lives.
And it is her children that are on her mind as she suits up in a double layer of protective gear. She's extra careful, knowing that exhaustion and carelessness could be fatal. And yet she is back again the next day. This kind of dedication was truly inspiring to witness. And good to know there are people like Diana Sarte, as Ebola is a deeply dehumanizing disease where the sick and dying are even deprived of a loving human touch. As correspondents, we are used to covering war zones, which carry their own unique risks. But this battle zone was an assignment like no other. Here, the killer is silent and invisible. You don't know when it could attack. And whilst in war zones, the danger recedes when you leave. Here, with Ebola, the danger could still be carried within you.
That's our Debora Patta, who is one of our heroes for being willing to go there and report this story.